Health pioneers present serotonin, why you need it and how to boost levels naturally. If you are new to this channel, hit the subscribe button and turn on the notification bell for relevant health topics. What is serotonin? Serotonin is a type of chemical that acts as a neurotransmitter, meaning it helps to send signals from one area of the brain to another. The chemical name for serotonin is 5-hydroxytryptamine, and it's sometimes called 5-HT. As a neurotransmitter, it controls neural activity and plays a role in a wide range of neuropsychological processes. Serotonin versus dopamine. What is the function of serotonin and dopamine? Both are neurotransmitters that play a role in depression. Serotonin functions as a mood regulator, and it also plays a role in many other body processes, like digestion and sleep. Dopamine is connected to what's called the pleasure center in the brain. Your body gets a rush of dopamine when you are rewarded, but low levels of dopamine may lead to low motivation and feelings of helplessness. Serotonin benefits and uses. 1. Improves mood and memory. Studies indicate that low brain serotonin levels are associated with poor memory and depressed mood. We also know that serotonin and tryptophan produce alternations in the gut that alter the gut-brain axis and impact your mood and cognitive health. Researchers have been able to explore the role of serotonin for depression by investigating the effects of lowering dietary tryptophan levels, causing a lowering of brain serotonin levels. 2. Regulates digestion. 95% of the body's serotonin is produced in the intestine. Research shows that the chemical plays a role in intestinal motility and inflammation. When 5-HT is naturally released, it binds to specific receptors in order to initiate gut motility. Serotonin also regulates appetite, and it produces more of the chemical to help eliminate foods more quickly when they are irritating to the digestive system. 3. Relieves pain. A study published in the journal Pain Research and Treatment found there is an inverse correlation between postoperative pain levels in patients with chronic low back pain and serum serotonin levels. Another study found that when healthy volunteers underwent acute tryptophan depletion to manipulate 5-HT function, they experienced a significantly reduced pain threshold and tolerance in response to a heat thermode. 4. Promotes blood clotting. We need enough serotonin to promote blood clotting. The chemical is released in blood platelets to help with wound healing. Plus, it works to narrow tiny arteries so they form blood clots. Although this serotonin benefit helps in the healing process, there's also evidence that too much serotonin can lead to blood clots that contribute to coronary heart disease, so it's important to stay within the normal range of serotonin to prevent adverse effects. 5. Helps wound healing. A study published in the International Journal of Molecular Sciences found that serotonin acts as a potential therapeutic candidate for enhancing skin healing in burn patients. Researchers found that serotonin significantly accelerated cell migration and improved the wound healing process in vitro and vivo models of burn injuries. Serotonin syndrome causes and treatment. Serotonin syndrome, which is a type of serotonin toxicity, is when high levels of the chemical accumulate in the body. This is sometimes caused by taking 2 or more medications that raise levels, or combining medications with some herbal supplements. Abuse of illegal drugs, like LSD, cocaine, ecstasy and amphetamines can also cause this condition. The most common serotonin syndrome symptoms are anxiety, restlessness, agitation, sweating and confusion. In more serious cases, it can also lead to health issues like muscle twitching, muscle stiffness, irregular heartbeat, high blood pressure, high fever and seizures. Research also suggests high serotonin levels increase the risk of osteoporosis due to its effects on our bones. If you notice these symptoms, consult your healthcare provider and talk to him/her about having your levels tested. For people dealing with this condition, serotonin syndrome treatment involves withdrawal from the drugs or medications that are causing your chemical levels to be too high. There are also medications that are used to block production of the neurotransmitter, such as periactin. Precautions and drug interactions. If you are concerned about low or high serotonin levels, consult your healthcare provider. Before using pills or supplements to correct a deficiency, seek advice from your doctor, especially if you are already taking medications to avoid interactions. There is not enough research to support the use of serotonin supplements during pregnancy or while nursing, so be sure to ask your healthcare provider before using them. Thanks for watching. Please like and share this video.